Hi guys, J.A. Graves here with Total Body Rehab. We want to welcome you to a new series that we're rolling out today, and we're going to carry this on as long as we need to over the next several days and weeks and maybe even months. We're not sure, but what we want to do is we want to bring you guys some really great content. And this series is called Treat Yourself, all right? So the big thing here is we want to help you guys who are stuck at home right now treat yourself, all right? So if you've got neck pain, shoulder pain, back pain, hip pain, knee pain, ankle pain, foot pain, whatever pain, we want to help you, all right? So what we're gonna be giving you guys is everything we possibly can that would replicate what we're doing in the clinic to help our patients. Now, if you need any extra help, we want you to know that we're here. You can come to the clinic. We're still open. We're being super clean. We're doing everything we can to protect you guys. We're also offering telehealth. But if you just don't want to explore those options, which we totally respect, we want to give you the opportunity to treat yourself. Here we go. All right, guys, so the first segment of Treat Yourself is going to be the cervical spine. And specifically what we're going to do is we're going to break this down for you over the next couple of days on ways in which you can self-assess or examine and treat. All right, so today what I'm going to start with is how to self-assess and treat headaches. Now, over the next couple of days, we're going to do two different segments on headaches. Today, we're going to focus on what we call cervicogenic headaches. What does that mean? A cervicogenic headache is a headache that starts from the neck, right? So genic meaning it starts from, or genesis, and cervico meaning cervical spine. So if you have headaches that are preceded by neck pain, or you have neck pain that leads into a headache, and it's usually on one side that wraps around the head like this, sometimes it can be felt over top the eye, this is for you, okay? That is a cervicogenic headache more than likely. Now, it can often be confused with a migraine. If your migraine medication is not working for a headache that looks and feels like this, it might be cervicogenic in nature, all right? So I'm gonna show you a couple different tests you can do to identify if you have cervicogenic headaches, and I'm gonna show you exactly what we would do in the clinic to help you take care of this. All right, guys, so we're going to start with what we call a cervical flexion rotation test, and this is to help diagnose a cervicogenic headache. So you're going to lie down, lift your head, and turn your head either direction, okay? Now, the important thing here is that you turn your head with your arms and with your hands. You don't want this to be an active movement. In other words, you don't want the muscles of your head and your neck turning your head. You want your arms to do the work. All right, guys, here's another view of that same cervical flexion rotation test. What you're looking for when you do this test is you're looking for and feeling for a side-to-side difference in movement and or pain associated with one direction. All right, guys, next we're going to use palpation or touch to try to identify if we have a cervicogenic headache. So you're going to take your hand and slide down off the bump that we talked about earlier and over just a few finger breaths. From there, you're going to put pressure and see if the pressure increases or decreases headache. In addition to feeling for whether or not pressure increases or decreases the headache, we're also feeling for any general tenderness that might be present on one side more than the other. This can also be done with two hands, in which case you put pressure through the right and then the left, and you can go back and forth and try to identify what area feels more tight or more tender. We're also trying to identify if the side that is more painful matches up with the side where we had less movement with our earlier test. All right, guys, so if any of the tests that I just showed you reproduced your headaches, or you felt like, you know what, I feel like maybe my neck is causing my headache, I'm gonna show you exactly what we would do in the clinic to treat you, all right? Now, this is a little bit of a condensed version because we don't have all the equipment, but this is a first-line intervention. In other words, if we deemed that you had cervicogenic headaches in the clinic, this is what we would be giving you to do at home to help with that, all right? This is called a C1, C2 snag, all right? So all you need is a towel, or you can use a pillowcase, or I suppose a shirt, but you want something with a little bit of a rough edge here, or something that's a little bit kind of hard or tight right there. So the way we're gonna set this up to start is you're gonna put the towel around your neck, but specifically, you want to find the little bump we have on the back of our head, and you wanna slide the towel down until you're just below that, okay? That's gonna indicate that you're on the upper segments of your cervical spine, the area where typically these headaches derive from. Just like that. Then you're gonna take one arm, okay, in this case I've got my right arm holding onto the towel and I'm pulling straight down with that, while my left arm is up like this, holding onto the towel on the other side. The movement is going to be rotation towards the top side arm. So in this case, I'm gonna be turning to the left. Okay? As I turn, I'm pulling into the towel with my left hand and my right hand is stabilizing. The important thing here is that you keep tension on the towel throughout. So even when I'm pulling here, I have tension, and when I'm coming back, I still have tension with my left arm. Let me show you a different angle here. Okay, so these exercises or these movements that I'm showing you right now, they should be mostly pain-free, and what you should notice is they should start to gradually decrease your headaches. So give these a try if you think you're having cervicogenic headaches, and then leave us a comment on this page or on our Facebook if you found this to be helpful. If you've had headaches and you tried this and it helped you, let us know, let everybody else know. We want this information to spread like a wildfire because we want to help you guys. Again, we know you're stuck at home struggling, and if you've been dealing with headaches, I know how big of a pain in the neck and head that can be. And so please give this a try and then let us know how it works out for you.